You know what's interesting about a dental chair? Nobody lies in it. The moment you sit down, something shifts. The small talk stops, the walls come down, and people start telling you things they've never told anyone. Their fears, their regrets, their dreams, their secrets. I've heard it all. My name is Adriana Capelli. I am the VP and COO of Capelli Dental in Hillsdale, New Jersey. And for the last 3 years, I've had a front row seat to some of the most real and remarkable human moments I've ever witnessed. This podcast is where the stories live. Confessions at the Dental Chair, where we talk about life, business, love, loss, and everything in between. Because the most honest conversations happen when you are leaning back, staring at the ceiling, and you realize you have nowhere else to go. Welcome. I'm glad you're here. Let's begin.
Welcome, Melissa Morgan, to our podcast, Confession at the Dental Chair. It's an honor to have you. You've been a patient of our practice for a few years now, a friend. You brought your husband, your kids, and tons of patients to
Cousin, yeah, everyone.
Thank you so much.
Bring it all.
For the trust that you bring to our practice. So today, you're a very interesting person. You do a lot of things. You are an occupational therapist. You are a pelvic floor specialist. And what else?
I do intimacy counseling. I work with kids. I work with men, and I work with women, because everyone thinks that pelvic floor is just for women, but we all have pelvic floors. So men need it too, just as much as we do. And it's not as openly talked about as it's becoming with women. It's not as taboo anymore. Like, women are starting to talk about it, especially with their friends more. And it's coming out. You see it all over Instagram, TikTok, YouTube. And then with the kids, it's really important. And a lot of people don't know that we can help kids as pelvic health specialists by with like peeing, if they have withholding behaviors, because something that happened, especially with pooping. Withholding can cause constipation, therefore causing withholding behaviors. And then also wetting the bed is a big one, and it could be an easier fix than people think. And then I work with a lot of children that are on the spectrum, because they have a hard time understanding interoception with the body. But with men, it's like a lot of different things. They need just as much as we do sometimes, and they don't know that there's help out there for them, but they're embarrassed to talk about it. Women, I do a variety of different things with women. And the one thing about pelvic health that a lot of people don't know, it's just not the pelvic floor muscles.
Can you explain with great detail about pelvic floor? What is the importance of it?
The importance of pelvic floor, a lot of people have back pain. They have hip pain. A lot of people will pee their pants, whether it's just throughout the day, or while you're doing an activity like running, jumping. Some women playing with kids, it's like they struggle with that. Sometimes it's intimacy issues, like pain with sex, which a lot of people will go through and not know, especially women, not know that they can get help with that. That's huge. And it's really frustrating when I get in a group of women and they're like, I had painful sex.
Yes.
Be enjoyable for you, turns out to be something very painful.
What causes that?
It could be a variety of different things. I'm also trauma-informed, certified in pelvic health. So, and that just doesn't mean what you think it means. It's things that have happened throughout your life. I've had people that have been brought up in a very strict Catholic household, and they've always been told sex is bad, sex is bad. If you go out and have sex, I'm going to kill you. Like, yes. That's the old school parent. Yes. So in their mind, when that comes up into intimate issue, all of a sudden they tighten up. So it causes them to have tightness all in their pelvic floor throughout their body, which then causes a lot of pain with that. They can have tightness surrounding the pelvic floor, which will cause a lot of pain with that.
So pelvic floor is the muscle itself?
It's muscles itself, okay. But when we come down to it, it's part of our inner core. Okay. So a lot of people don't realize that we have our outer core, which is our rectus abdominis and our obliques. Okay. They're great. Especially if they're nice and fit, you get that six pack. Then you have your inner core, and it always starts with your diaphragm. So people don't realize that breathing properly, a nice 360 diaphragmatic breathing, is important for your pelvic floor because it's the conductor. So when you take your deep breaths, your diaphragm goes down, your pelvic floor goes down, okay? And people don't realize it. So if you're not breathing properly, you're not working your pelvic floor. And a misconception about pelvic floor a lot of times is that, oh, your muscles are too weak. Well, it's not that your muscle is too weak all the time. It could be that your muscles are not coordinated. Or my little pelvis right here, your muscles are tight surrounding your pelvis. So that's why we talk a lot about hips. And if you have hip pain, a lot of people will go to a regular PT because they're like, or a chiropractor, and they don't realize like it could be a pelvic floor issue, because what we don't realize is that we have muscles surrounding our pelvis that originate here.
Okay.
And they happen to be our hip movers. So they happen to be internal external rotators, flexion, extension, abduction, adduction, all the movements of the hips. Also, we have muscles that come from the spine that attach into the pelvis that will give us some back pain. So there's a lot of different muscles that are surrounding that can affect your pelvic floor. So if you're tight around here, you might have problems with your pelvic floor because you're not learning to contract and release, or you're not learning to breathe properly. It's more involved than people think. They think the old school Kegels, where you just, my doctor told me like to hold my pee in all the time. They're like, just stop and hold your pee in. Well, you're not really doing what you call Kegels or reverse Kegels.
Yes.
You're not helping yourself because you need to learn to breathe properly. So a lot of our body has to do with our fascia, which is our fascia is the connective tissue over our muscles, tendons, and ligaments.
Okay.
And what happens in our daily life, like I've said with trauma, is the connective tissue gets nice and tight. It holds all our emotions in there. So a lot of times our fascia has to be released in order for things to work properly. So you might have tight hips, which is causing some posture issues. It's very, very more involved than what people think. People just think it's these 14 muscles that sit right in here. 14 muscles that sit right in this thing, but it has an involvement about everything. So people don't realize that. So they'll go to a regular PT for back pain when they found out the back pain is being caused by something going on with the pelvic.
Yes.
So it's very more involved than you think.
And everything is connected to the brain.
Everything is connected with the brain, nervous system. Your nervous system, parasympathetic and sympathetic, biggest nerve, cranial 10, all your window, like having, the higher arousal or just being low, you need a good like up and down to help your body heal. But yeah, that's why they're big about vagus nerve and vagal toning. Those vibration plates, walking out on grass to ground yourself in the morning, breathing, humming, singing, gargling, all those things help your nervous system. When it comes down to it, we all need to learn how to relax and calm our bodies. Yeah, it involves a lot of it.
So take us back to the moment when you decided to become a pelvic floor specialist.
Okay.
You were seeking for answers.
I was.
Okay.
I was getting very frustrated. I was getting frustrated for women surrounding me. And I was hitting the age of my 40s. And of course, perimenopause coming in, and I was like, I'm not gonna not know what's going on. So let me do some more research. So a lot of women were having problems, like around me, and I was having my own problems. So I started researching as an occupational therapist, what I can do to help them. And I was working in pediatrics for a very long time and starting to get burned out with my body because it was a lot of heavy duty stuff with that. So I researched and looked into pelvic health and found a great mentor that taught this class that takes over 6 months, and you can be certified in it. And so I took the course, learned about the pelvic health, learned about colorectal, which involves pooping, and then learned about trauma-informed, and that got me into pelvic health. And at first I was like, I'm just going to do women like we all do. We're going to take care of women, postpartum, prenatal. And you know what? I prefer taking care of everyone.
What is the biggest concern when you talk to women? Something that is not being addressed or they're afraid to talk about?
Well, they all think it's normal. They all think peeing your pants is normal. And they think that nothing will help it because everyone has said, the joke is, oh my gosh, I'm laughing so hard, I'm gonna pee my pants.
Yes.
And they'll just put pads on to help soak up the pee. Like they'll just ignore it when it's easier fix than you think. It depends on your case. It depends on your situation. I could see people for 4 weeks. I could see people for 6 weeks. I could see people for 8 weeks and they're done. I've had a person walk out in 4 weeks. So she was able just to really connect mind and body. She didn't have that much. She had a little bit of leaking. She was being proactive and she walked out of my office feeling great. And I set her with exercises to continue with. And also sometimes it's re-education. It's your behavior modification. We talk about behavior modification for kids. We have to do it as adults. And sometimes we have to re-educate our bladders because our bladders have problems too. And we teach them the problems. So it's like everyone thinks it's normal. Like it's common, but it should not be normal.
It should not be normal. You served a lot of women in Bergen County. Yeah, they all seem to be all put together, correct?
Yeah.
But what is the silent struggle that you see?
I would say painful sex. They're afraid to talk about it.
Okay.
I mean, I say it's very big because it comes in as second nature when they come in to talk to me, and they'll be like, also, I want to talk to you about, I have pain with sex. There's some people that, like, even if your uterus is a little tilted, you will have pain with sex. And the easy fix is let's try different positions. Have you and your partner try different positions to see what's going on? It's a lot of that situation. It's really sad that they don't talk about it. I had a mother and daughter come talk to me, and they're very open with each other. And she's like, I don't want you to have painful sex like I had all those years. And it's really sad. I don't like that. So they don't have it all together because there's a little secret that they don't talk about.
Definitely.
Yeah.
And most of the times, I think their partners don't even know.
No.
They're not aware.
It's the communication. Yeah. It's a lack of communication because, and I don't want to say this about us women, but women are taught to, we're second nature. Like it's not, we're not supposed to talk about it. I mean, back in the day, we were there to give babies.
That's it.
And not have pleasure. And that's what's really sad. And I hate that. I hate that so much. That's why I have the intimacy aspect, is I like to educate I hand out lube left and right, man. It's like it's like candy.
What is one thing you want every woman or every man listening to this to know?
That it's okay to ask for help. Especially, it's okay to question things. It's okay to get more knowledge. Don't have to be shy about it. Out and talk to me about it. You can find people that will be, I'm so comfortable about talking about anything with any age group. So I love, but please don't suffer silently in pain. Don't think that peeing the pants is okay. Especially men, prostate issues, like that's what happens. Prostate cancer, we can help things in that. Even common things as erectile dysfunction, like don't be ashamed. Come get help. Like always fight for you. My major thing is, with any of my patients, you are the person for your healthcare, so you need to fight for your healthcare all the time.
What's next for Melissa? What's exciting?
Well, since I opened my own place in April, I have my ribbon cutting on June 10th. I am going to become certified in menstrual cycle. I'm finding too many young ladies don't know how to track their period, don't know what a good or bad period is, not to look at for any form of things going on. I have women as young as mid to late 30s coming in with hysterectomies, is increasing. A lot of endometriosis, which used to be PCOS, now it's PMOS. Finding a lot of that. So I want to educate a lot of people about their bodies, and these are things that we should know about. A lot of misconceptions over hormones, and that's men and women hormones. So I want to do that. I also always bring it back to love of my pediatrics. I love working with kids. I've been doing that for years already. I started doing like books, in the future, I do like busy books with Velcro. I love learning, so I will never stop.
This is your mission.
It's my mission. I want to help as many people out, like, to have better health.
Of course.
That's what I want to do.
Definitely.
Yeah.
Where can they find you?
I am on my office at in Oradell, right on Kinderkamack, 334. I'm at my office there, and it's right across from the fire station. It's a small little intimate office up top. I have a Facebook, I have Instagram, I have a TikTok. So it's all Grace Pelvic Health and Wellness.
Okay.
So .com. And you can find me on there. I try to post as much as I can on Bergen County to let people know where I'm at.
Yeah, I love your post, by the way.
Yeah,
Hysterical.
I try to have fun with them. Try to do some crazy stuff with us.
Yes,